clinic. Today, I'd like to thank Baby Chakra for giving me an opportunity to go live and talk about MISC, which is a complication post-COVID in some children's. So I'd like to brief about MISC to our viewers first. So MISC is a relatively new disease which has been started post-COVID actually. So it is, as the name explains, it is a multi-system inflammatory syndrome in children post-COVID. So many of you might be thinking that every child who suffers from COVID, does they have to go through MISC, or do they have this complication of MISC? But usually not. Around 90% of the kids post COVID don't go through MISC, but yes, definitely 10% of the children who fall through in this spectrum. So MISC is basically an inflammation of the various organs of the bodies. It is a multi-system organs. So especially it affects the skin, the eyes per se, then kidneys, liver, the heart, and the lungs. So these are the various main organs which it affects, and sometimes the brain too. So I would like to make our viewers understand why does the MISC happen. So how does why does the MISC happen actually? So the SARS-CoV-2 virus, usually you might have seen in the adults, the COVID infections are quite severe in some certain categories of population, but in pediatric population and children, the COVID infections are not very severe. They are just like mild flu-like symptoms with cough, cold, fever for few days, and then usually 90% of the kids get better. However, after 4 to 6 weeks of infection, certain antibodies are produced by the body in response to the COVID infection early on, and these antibodies go into a zone of fire in the body, which causes a lot of inflammation in various organs, which results into this disease. And these are uncontrolled reactions, and unless treated, this disease can be fatal. So I would like to tell our viewers about how do we uh, suspect if anyone is going through MISC or anything like that. MISC has certain very set criteria by the World Health Organization. In that, we have definitely fever for more than 3 days, more than 101 degrees Fahrenheit fever, with a with any of the above symptoms like diarrhea, sore throat, skin rashes, conjunctivitis, or someone who cannot maintain their blood pressures, who has a very fast heartbeat, who has an abdominal pain, vomiting. So you might be wondering, it is almost like a generalized viral infection, but these kids are generally way sicker than the normal viral infections, and they tend to become sick if not treated early on. Uh, MISC does require MISC does require an ICU care in most of the settings. So how do you understand if your child is suffering from MISC or any other thing? Is if the fever is not responding for more than 3 days, and if at all any of the above symptoms which I described, you should definitely go visit your pediatrician to have a check on the MISC, because other illnesses similar to like viral illnesses are very much treatable at home, but MISC requires a lot of immunomodulators and other cardiac supports in the ICU settings to treat your patients. Some of the long-term complications of MISC, which we have seen in the second wave, post second wave, a lot of kids did face problems with heart failure. That is a number one. Heart failure was one of the most severe complications of MISC, which usually begins by day 3, day 4 onwards, and the kid suddenly presents with breathlessness, not responding to any oxygen, nothing. So they need cardiac support plus some oxygen, and definitely the diagnosis depends on how well we can catch it early so that we can treat it. Uh, when the diagnosis becomes later than 1 week or 10 days later, if this diagnosis comes to a doctor, sometimes it is too late, because this inflammation in the body can cause the coronary arteries in the heart to dilate in size and become an aneurysmic size. So they are sometimes irreversible changes and can cause in future heart problems in the patients. So we need to be careful about that. Um, Looking on to COVID vaccination. Yeah, we'll start. We can take some few questions from the audience. So we can start with some questions we can take. So one of the questions is, are there any complications that kids might have in later life if they suffer from MISC? Yes, definitely. Usually 95% of the kids will not suffer any complications if treated early on within 1 week of the onset of the MISC. However, if this, as I mentioned, that if kids are treated later on, then they do have remnant cardiac problems, which can lead to later on cardiac diseases. So, other problems like the skin problems, the eye problems, the lungs, and the liver, usually they are reversible, and they have 100% recovery rate as per the complications are concerned. So there's another question which like to take up. Do kids who are vaccinated against COVID also suffer from MISC? So there was a recent study about vaccinated versus unvaccinated kids in the US, which showed that kids who are vaccinated have a different kind of COVID antibodies, which are actually well protective against any multi-system inflammatory syndromes. So I'll definitely recommend that kids who are vaccinated are almost 95% better off than who are not vaccinated, and they don't usually suffer from MISC. However, there are one or two cases which kids are vaccinated and do suffer from this illness, but the chances are very less compared to unvaccinated kids. So we'll take one more question is, how do you prevent MISC? I'm sure a lot of parents want to know that how do you prevent this MISC? Well, prevention of MISC is how our COVID protocol follows. So if you can prevent COVID infections from happening in your place, in your building, in your society, or spreading the infection, the MISC can be prevented. So MISC general rules are washing your hands, no contact with the people who are sick, isolation, and maintaining hygiene, multiple using of disinfectants when you are and using a mask definitely, and social distancing. So these are the some things which can prevent COVID-19 infection as well as transmission of COVID-19 to other especially in the pediatric population, and preventing them from getting this complication post COVID. So the takeaway message for all the moms here is that COVID-19 though may not be a serious threat to the pediatric population and children, however, adults should act responsible, maintain the COVID according protocols and safety measures so as to prevent this infection from happening to your kids, so that no one suffers from this kind of complication, which can easily be prevented by our alert behavior and certain measures of social distancing. uh, in cases if this happens, we have seen almost 95% of the recovery. Do definitely 5% of children who are, for which who it is fatal, do usually die because of any lung or the heart complications. However, early stopping of inflammation does give us no future complications to the child, and prevents mortality and morbidity in your child. This is definitely not very, I won't say it is very easy to treat, but definitely treatable with a lot of immunomodulators and a good team with care. And usually the kids do well within 4 to 5 days of treatment. Like any other questions? Yeah. Thank you. Thank you.